Hello, welcome to news talk presented by the SchrDbb. In this tutorial, you're going to see pre-eclampsia. Now, to see this tutorial, we are going to visualize the SchrDbb algorithm, which is going to be made up of we have the disease, the differential diagnosis, the endemic disease, we have the cause, we have the complication. And now upward you have the background, and lastly the prognosis. So we are going to visualize with respect to this SchrDbb algorithm. Now the next thing that we're going to see, the first thing you're going to see in pre-eclampsia, we're going to start from a background. I've already said that this diagram corresponds to the other diagram where the disease is going to correspond to the mechanism of the disease. After the mechanism of the disease, now above it you have the pathogenesis. After the pathogenesis, now below it we have the pathophysiology. After the pathophysiology, now outside we have the epidemiology and the risk factors, and lastly we have the follow-up with the prognosis. So now those are the different elements that we're going to visualize when we're going to see pre-eclampsia. So now we start with the first element of our tutorial, is the definition of pre-eclampsia. Every time you want to actually know the mechanism of a disease, you must start with the definition of that disease. So what is the definition of pre-eclampsia? Pre-eclampsia is defined as a multi-systemic, it has 5 points. The first point is multi-systemic disease. Is it clear? Pre-eclampsia is first multi-systemic disease. Second point, of unknown etiology. That's the second point that you should have in mind when you're defining pre-eclampsia, of unknown etiology. The third point, occurring after the first half of the pregnancy, after 20 weeks of gestation. It occurs after the first half of pregnancy, that is after the first 20 weeks of gestation. Then the next point, after the first half, characterized by a blood pressure of more than 140 over 90 meters of mercury and a proteinuria. And when we say proteinuria, it means that it is more than 300 milligrams of protein in a 24-hour urine sample. Is it clear? So those are the different elements that you must have when you are defining pre-eclampsia. Is it clear? So now, after having a definition, we should have now the risk factors. We need to know that this tutorial is based in order for you to bring out a history so that you can have the disease from it. Is it clear? So to bring out the risk factors of pre-eclampsia, you need to know that what the risk factors of pre-eclampsia are divided into: one, we have the obstetric risk factor of pre-eclampsia, and then the next point we have the after the obstetric risk factors, we have the gynecologic risk factors of pre-eclampsia. Is it clear? The gynecologic risk factors of pre-eclampsia, obstetrics and gynecologic risk factors of pre-eclampsia. Now let's start with we have the obstetrics, we have the non-obstetrics risk factors of pre-eclampsia. I'm sorry about that. Obstetric and the non-obstetric risk factor of pre-eclampsia. Now for the non-obstetric risk factor of pre-eclampsia, we have the risk factors related to hypertension, risk factors for hypertension. Is it clear? And we have others. So now let's start with the non-obstetric risk factors. Is it clear? The non-obstetric risk factors of pre-eclampsia, with the risk factor related to hypertension. The first risk factor related to hypertension, you need that is obesity. Is it clear? If a patient is obese, if the patient has a sedentary lifestyle, is it clear? I'll just use the ARTS mnemonic. Is it clear? Sedentary lifestyle. The third one, we have alcohol consumption. Is it clear? The ARTS mnemonics. This is a ARTS mnemonics. A for alcohol consumption, D for dyslipidemia. If the patient has dyslipidemia, or the patient has diabetes mellitus for D, and then S is for sedentary lifestyle or smoking. So those are the risk factors for hypertension that we can have. Is it clear? Now the other risk factors which are non-obstetrics, we have the extreme ages. is equal to the extreme ages, meaning that what the patient who is less than 18 years old or a patient that is more than 35 years old. The first, if you have a mother with a first child at more than 35-year-old or a child less than 18-year-old, is a risk factor of preeclampsia. So those are the other etiologies. Now we have other etiologies. So we have the first extreme ages in the among the other non-obstetric related cases. This second non-obstetric related cases, second non-obstetric related cases, you have psychology. Is it clear? The psychological stress is also another non-obstetric related case where a woman can have preeclampsia. Is it clear? And then we have other cases which are related to, so we have other cases which are idiopathic. It may just occur like that. Now we have the obstetric risk factors for preeclampsia. What are the obstetric risk factors of preeclampsia? The obstetric risk factor of preeclampsia are anything which is as a result of the pregnancy that can result to preeclampsia. Are you understanding? So what are those things? The first point, you can have a multiple gestation. So if you have multiple gestation, you need to know that what? You need to know that preeclampsia is usually occurring as a result. The thought mechanism of preeclampsia is that you have the abnormal growth of the trophoblast. Is it clear? Since you have this abnormal growth of the trophoblast, is now resulting to an abnormal increase in blood pressure. I'm going to explain the mechanism for you to best understand. But multiple gestation is going to increase the prevalence of those trophoblasts. That's going to be a risk factor. Another risk factor can be abnormal implantations of the placenta. Is it clear? And in the cases of placenta accreta, you have placenta increta, and the last one is placenta pecreta.